just scan around the room. We obviously have more than 10
3,
people,
4,
so I'm not going to make everybody count
7,
off.
8, 9. Okay. We got 12.
Thank you. We did good. Thank you all for helping me with this. I greatly appreciate this. I am taking classes at the University of Tennessee. For the few of us who are in here young, if you don't have your degree, get it early because going back to school at 50 sucks. Just saying. Okay. My name is Tami Greene, and what I'd like to talk to you today is about the dangers of being too sweet. And I am not directly referring to Paula Deen moving into Pigeon Forge with her new restaurant, y'all. I'm talking about the effects of diabetes on the American family. Okay? As we know, healthcare costs are skyrocketing. It has reached the point that healthcare costs are unsustainable in the United States. And what we don't realize is that we have the ability to change that for our own families, for ourselves, to make an actual impact. Many of us don't realize that between 58 and 71% of the people who are affected with diabetes, that could have been postponed or even prevented. So we do have the ability to make a positive impact and a change for ourselves and for our families. Now, what a lot of us don't realize, we hear these huge numbers on the news about how prevalent diabetes is. Okay? No. And we don't really, they don't make sense to us. So I'm going to throw some numbers out there to you, and I got most all of these from the American Diabetes Association or from the Center of Disease Control, and that's the first one that I'm going to give you. Is that we know that heart attack and strokes are biggies. In the United States of America, approximately 1.5 million people each year have either a heart attack or a stroke. And that comes from, like I said, Center of Disease Control, and they got their numbers from the American Heart Association. In 2012, there were 1.7 million new diagnoses of diabetes. So that means statistically you are more likely to be diagnosed with diabetes than you are to have a heart attack or a stroke. Now, we've got several people in here that are getting close to the age of 65 or have passed the age of 65. It is estimated that a quarter of the people 65 and older, 1/4, have diabetes. And unfortunately, a lot of that is undiagnosed. So we hear those numbers. But what does that mean to our families? So we're going to break it down because there are two ways that it impacts our family. It impacts it with the complications that we have heard about, and we're going to touch on those. But it also impacts you financially every day. There is a gentleman, Mr. Monroe, and he does an article for Forbes every year, and it's breaking down what health care costs the American family. This is your out-of-pocket cost and your insurance premium. And in May of 2013, what he came up with, crunching all of the numbers, is that each family of 4 needs to plan on $30 a month for your out-of-pocket health care. Now, I've kind of jumped to that. What they say is that it costs approximately $762 a month for the family of 4 for their premiums and their out-of-pocket. So we're going to do a little play, and we're going to assume that 85% of that is what you pay in your health care premiums. So the last 15% would be $30 per person. And that sounds about right for most of us. But the American Diabetic Association said if you have diabetes, you're going to spend 2.3 times of that. So because I have diabetes, my family has to put back an additional $69 a month just for me. So my monthly health care cost is about $100 a month. Now, when you have diabetes, that also affects your work performance. There's a group called the ADP, and they do work-based data. American absenteeism is about 3.2%, which translates that the average American will miss 8 days of work a year if they work 250 days a year. And that gives you your 5 major holidays off and 5 days of vacation. But there's a group called Diabetes America in Texas, and they do this sort of data and do treatment with diabetics. And diabetics on an average will miss an additional 8 to 11 days a year. So that means if we go conservatively, that means I'm going to miss 16 days a year out of my work year. That translates to 1.3 days a month. About a day a month, a little more. So another statistic I got was from the Census Bureau. And believe it or not, the median income in Knoxville is $44,100 a year. Okay? Some of us make a little more, some of us make a whole lot less. Okay?
Category.
So, if we translate that and break it down to our daily earning, it's about $176 a day. So if I miss 1.3 days a month, I'm missing about $228 a month that I'm losing in income. If I take that $228 a month plus just the $69 extra, that means I'm costing my family, I'm costing me right at $300 a month. We're losing just because I've got this stupid disease.
It ain't stupid.
It hurts. Okay? So, you figure $300 a month, but 58 to 71% of diabetes can be prevented. Why are we not paying attention to this epidemic that we have some control over? I'm not trying to scare you, but those are just the statistics of having it and what it costs. But if you have some of the complications, hypoglycemia, hyperglycemia, the low and the high blood sugar, about 425,000 visits a year to the emergency room just because of those two things. If you have the pleasure of having diabetes, let's tell you what your consolation prizes are. 71% of us have high blood pressure. 65% of us also have to take medication or have high cholesterol. Each year, the Center of Disease Control, and it fluctuates, but between 12,000 and 24,000 new cases of blindness because of retinopathy. In 2010, there were 73,000 cases of amputations that were non-trauma and lower limbs. 60% of those were because of diabetes. And the American Kidney Association estimates that 44% of kidney failure is because of diabetes. This is really an ugly, ugly disease. But how can you stop it, prevent it? There are two main things, folks, and we already know them, and I can bet you're turning them over in your head. We can reduce the amount of processed food that we eat, ingesting sugar and processed flours. The other thing is to get moving. And it doesn't mean that you have to start walking a mile. You don't need to walk laps. If you've got a bad back or you've got bad knees, you can sit in a chair. We can flap our arms like little birdies. That is moving. You can do walking while you're sitting. You can do leg lifts. You can do twists. Now, the processed food, that means McDonald's. It also means one of my favorite places is Shoney's Breakfast Bar.
Sorry, Mom.
No, it's horrible.
That was sarcasm.
So I have there's only one thing in here on this picture that is not processed, and that is the fruits. That is so sad. But there are things that are in our pantry that we eat every day that we don't think about. How many of you start your breakfast with instant oatmeal. Oatmeal is a good food, but the instant oatmeal is over-processed, and it has a lot of sugar in it. Regular old traditional oatmeal. It says 5 minutes to fix. I cheat. I throw my oatmeal in the water before it starts boiling. My oatmeal is done in 4 minutes.